Physiology since 20 years old, and I use it to do some courses about acupuncture and auriculotherapy since 2020 after COVID. Since COVID, I went to Paris to learn acupuncture because our problem as an anesthesiologist is where even we use opioid to the patient in post-operative, there is pain, and nurse come and say, it's not enough, I need more, and there is a side effect with nausea, vomiting, and sometimes a lot of pain, and the patient is not good, and the discharge is prolonged. So I decided to do acupuncture, to learn acupuncture by curiosity. And I did a diploma in France since about 1 year. Then I used it to do some courses in Morocco, but also in China. In China, I went last August to China to the International Academy of Acupuncture and Moxibustion. Moxibustion is the use of some plants burnt to tonify the acupuncture point before using the needle. This very effective. So this kind of medicine works since 5,000 years with efficiency. Modern medicine, Western medicine is efficient with development of technology, of monitoring, but the problem is not care of the patient with globality. This kind of medicine take care with global thinking, not mechanistic thinking. In our medicine, Western medicine, we use some medication, some procedure, surgical procedure, that is efficient. But for the patient, it's not enough. And we have trouble with psychological problems, depressions, and it's a therapeutic medicine. It's not preventive. This kind of medicine is preventive to allow the doctors, physicians, even intensive care medicine in the unit care medicine to take care of patients with the complementary effects. Not replacement. There is no replacement. We need to have our medicine, but we need to do other things which help people. So I went 1 month to last August to the International Academy in PG. So I tried to learn because I know acupuncture scientists. Because right now, acupuncture, it was energetic vision of the man connected to the universe with the planets and the Earth. There is some modification of the climate, and this influence patient, and there is a lack of homeostasia. So homeostasia is normal things. The balance between the yin and the yang. When there is a change in the climate, in some emotions, internal emotions like fear, anger, excess of joy, what else? Thinking or overthinking, sadness. There is an international emotion that influence the health of the patient. In the traditional medicine, Chinese medicine, they use it by external factor like wind, like the change of the climate when there is some warming or cold on our health. But also there is internal emotions that influence us to get sick. And it's important to think about it, about globality. This is Chinese thinking of the balance or imbalance. There is the imbalance influence the energy on the meridians, and it's blocked. When it's blocked in Chinese medicine, there is a we are sick. We are sick. So for the Western medicine, we wait until the pathology happens to get to care about this pathology. But for the traditional Chinese medicine, it's preventive. The best doctor in China is doctor who prevents the events of pathology, not to cure pathology. That is very important in our right now in this era. So in China they use an ancestral medicine. It's about 5 elements. 5 elements, you know, 5 elements is earth and metal and water. What else? Wood and fire. There is communication between, Lao Tzu philosophy about the thinking of the philosophy and the nature. And this kind of medicine is very old, very antique, very traditional. They use it with efficiency. They apply it in their hospital with Western medicine, but in complementary way for all people, because there is a program I think 2026. They want to that all Chinese people have a good health. So they try to do this kind of medicine. I had a chance to meet a patient with long COVID since January 2023, and he came to the hospital. It's in Peking. He was 38 years old. Was a man. He had in his history COVID in 2022. So he kept his pathology by having a pain on the throat, in the throat. The motive of consultation was that chronic fatigue and myalgia. This is symptoms of long COVID. But although cold feeling, in Chinese medicine, they didn't have temperature monitoring. Only putting their hair, the outer of the hand, and to feel if it's cold, fever with like this. We feel cold and fear of cold. In French we call it la peur du froid. La peur du froid. So this is the symptom. There was fever, but in Western diagnosis medicine, long COVID is known to have some neurologic problem, mental depression with some kidneys failure in some time, but we have musculoskeletal condition with myalgia, but also some cardiovascular problem like tachycardia, like hypertension, blood pressure, but also some respiratory sensibility to the cold and to have flu. Flu, even it's not COVID, but there is some flu. The person is very sick. And sometimes we have some blood clots like thrombosis in the arterial pulmonary or in the brain. But the problem in the Western medicine, that is the treatment is symptomatic only. but the problem is we need relaxation and psychotherapy for the patient. In traditional medicine, they use other things because they count too much with on the appearance of the patient. In traditional Chinese medicine, everyone has an appearance. With a person with appearance of metal, of wood, they have some particularity too, and some weakness. So we can take care of their patient with the appearance too. Inspection, but appearance and mobility and what is the kind of personality. So these patients with COVID, long COVID, has a white face. It is the appearance of the metal element. It was sadness because the weakness of the metal appearance is the sadness, to have the ability to be sad and to get to depression, nervous depression. We had repetitive flu or respiratory problems that he come to the hospital. He has asthma, constipation, and weakness at the fall. At every fall in China, they used to tonify some acupuncture points to the person with the appearance, every appearance, metal, wood, the beginning, because the metal is the autumn. The earth is the end of the summer. The fire is the summer with fire because it is sunny. In the wood, in the winter, in the le printemps. So on the water is the winter. So everyone needs to be tonified before the season to have a good health. In Chinese concept. The problem of this patient in the examination of the tongue, we know in Chinese medicine that this part of the tongue is, when it is red, very red, there is a problem in the fire element in the heart. Depression, tachycardia, this person has this problem, red part of the tongue. But also the lung is different. The lung part, the exposure to the lung is here, and he has a big tongue open to all. When the mouth is opened, there is no space, only tongue. It's the symptom of stagnation in traditional Chinese medicine. He has a purple color of the tongue. When we have a purple color, it seems to be a stagnation of the lung. He has a yellow and thick layer on the tongue that signifies there is a stagnation, and there is some mark on the teeth because the tongue is very big, and there is some mark of the teeth on the. It is symptom that perhaps it is stagnation in traditional Chinese medicine. The pulse is a very important part of the diagnosis. The pulse, there is a lot of pulse, more than 26 types to have diagnosis in traditional Chinese medicine. This person has in the right and on the left wrist shaking. You can try on your use radial pulse. Everyone has a different pulse about his health states. When we are in a good health, we have good pulse. But when we are sick, the pulse is very weak. We try it on our patient in intensive care. So this person has fast fast food because he has a deficiency in the heart, because the tongue was red, but because it was a problem, psychiatric problem with his health, or long COVID. He was silky like a rope, and with this diagnosis is diagnosis of stagnation in TCM. And all diagnosis was wind, heat, and stagnation. So the problem is a deficiency in lung, but also in the heart. So we need to tonify it and to take off this stagnation from this patient. So about the 5 elements, where you see the heart is fire, and the sense is like that, like a clock or not. The sense of this wood, fire, earth is the spleen, land is the metal, autumn, kidney is in the winter, and liver is the So the treatment will be acupuncture for this patient, lamp warming, we will see it, warming with lamp to take off the stagnation, but also some black shoe cupping. In China, they use a cupping, flashing cupping. Quickly, they put a cup and flashing cupping at the end of the session of the acupuncture session. For stagnation, they use this kind of lamp to warm the patient, to take off the stagnation. And the principle of treatment is acupuncture with needles, flash cupping on the back shoe, on the back, and warming with lamp, but also in the navel moxibustion. In the navel moxibustion. So I have moxa. This is the moxa. We put it on the first. We use salt on the navel, and we put this, and we some fire, and it's warm, and to keep very comfortable sensation for the patient, and it's the element of treatment. For anxiety, in the hospital in China, all persons are treated anxiety. When we have pain, we are anxious. So they use some acupuncture points, being found between the eyebrows. It is the point that use the Indians. They put some plants on it, red plants. This is a point of anxiety. It permits to have to be relaxed, comfortable. There is another point, Iku, large intestine, number 4. There is also on the head four points around the middle of the point by view. It's bottom, number 20, and around there is a 4 points, limit 6 strong, and there is a point in the elbow, forehead, named by Young. They use, everyone has pain, needs to have treatment of anxiety with acupuncture before starting the treatment. But they use the clock, biological clock, because we have deficiency of lung. But the couple of the lung in the Chinese medicine, the couple is large intestine. So we use also the acupuncture point of large intestine. This is oral and starts from 3 o'clock to 7 o'clock. It's the time when the treatment is the better to have better result when you use this time. And we know that the reverse is the bladder, and it's the time that the energy is very low of the lung in this time. So we need to do acupuncture in this area of time. 3 to 5 to in China they use two anti-point acupuncture by using at the elements, using elements. All acupuncture points, there is two kinds of acupuncture points. The yin meridian acupuncture point and the yang. Yin is the empty organ like heart, lung, spleen, liver, kidney, and there is also a fu named fu. It is a young element, young organ, large intestine, gallbladder, bladder. What else? Small intestine in the fire. So they use every kind of acupuncture, every jig point on the extremities of the meridian yin is wood, and every point at the extremity of the yang, not empty, is metal. So we start, and we know how is the acupuncture way to treat patients. This is jig-well, spring, and stream. You should know that to treat patients, when we use the first three points to treat stagnation, the heat, and the pain. The third point is for the pain, but the point on this area is for energy, in this area and this area. So if you know about traditional Chinese medicine, this is like I show you the 5 elements, because there is a cycle of creation and the cycle of control. This combination of points to help us to. In Chinese medicine, when we are looking for points, we don't have centimeters or inch. We have only the thumb, the larger of the thumb. It is 1 cun of the patient. We measure it by the thumb of the patient. If there is 1.5 cun, because it's written C-U-N, but we tell it cun, T with T and S. 1.5 cun, 2 cun, 3 cun, to do our measurements of the points to be effective and to have a good result with acupuncture treatment. So 1 cun, 1.5 cun, 2 cun, 3 cun. That's so before starting acupuncture, we need to wash our hands, but also you need to disinfect the skin and prevent the chaff and jelly in the collector. This is, I summarize, a type of point on 5 elements strategy protocol of Chinese medicine. In this patient, we have a deficiency and lack of energy of the lung. So we use tonification of the points of the line, and we choose 4 kinds of points. This is the points that help. This is mother, because there is a systemic and organized system with 5 elements. But I summarized it for you to be easier. So these points are length number 9. Another point, large intestine located here, and spleen 3. So to avoid spleen 3 is in this way, to avoid the lung energy to be more tonified, to keep this person better health. But they use two points named horary points. This is a point which has the name of the elements. For the lung, the horary element is lung number 8, here, located here. If we have some problem in kidney, or sexual problem, or because the water trait is deficiency in the problem, in neurologic problem, musculoskeletal problem, sexual problem, with the lack of the yin. Because when we are born, God gave us a lot of constitutional energy and powerful. And with age, we start to have less energy, like a battery. So with the elder years has low energy and have to have back problem, back pain, problem of the bones, problem of the muscles. So we need to tonify the kidney element with this point on Chinese medicine in 5 elements, like that. So tonify with kidney 7, bladder 67, lung 8, and kidney number 10, horary, because this kind of point represent the elements of the organ. This is the protocol that we use for this patient with long COVID. Spleen 3, lung number 4, number 9, lung number 8, and large intestine number 11. But we use also 2 types of points. The points named U1 or spring is point source. The point source. In the line we use line number 9, and for the communication points named Luo point is line number 7, located here to have more energy and more efficiency. Like you see on the land, if we have deficiency of fever, we use this point. If you have a problem of anxiety or tachycardia, we use to tonify, to disperse. You need to disperse in tachycardia with those points. But also, if we have bradycardia, we use to tonify these points of the heart organ or heart element. But in the beginning, in each season, we need to tonify the elements by using the horary points. Every element has a point in the same elements. There is an organ. For the kidney, the horary point is 10. Horary, in the beginning of the spring, we need to tonify liver every year. In the beginning, in each season, we need to tonify and do some session to treat with prophylaxis, not to give prophylaxis everyone. Early summer, we tonify pericardium or ventilator number 8 and half number 8. In the end of the summer, we tonify the spleen tree. At the beginning of the autumn, we need to tonify this point, lung number 8. But also, because there is stagnation, we need to fluid to the blood. The blood needs to be moved, and the flow need to be more accelerated with some points. Under 17 is dedicated to the blood, all problem of blood or circulation of the blood. Sorry. But also for stagnation we use by tongue or liver number 3 between the toes of the foot and the liver number 5 to treat stagnation. There is another point named spleen number 10 on the thigh to move the blood and to treat stagnation. But there is a kind of technique which is bleeding of the points on the extremities, like lung, to treat stagnation. Lung number 11, and we bleed it with a needle. You know the needle what we use to have glucose measurements, dextro. It's the same. We can use this needle and to bleed it, like bleed number for the liver and lung, but also because the couplet meridians. For the metal, we have lung and large intestine. Large intestine number 1. To use this kind of needle to tonify and to treat this stagnation. Donc, in the literature of TCM, this kind of points, bleeding points, make the Wei Qi. The Wei Qi is defensive energy, more tonified, more efficient, has a season that carry disease approach, eliminates wind and head, open the point bleed in this case, relieve the pharynx, and expel the symptoms that were present. But at the end, they use a flesh cutting on the back meridian of the bladder. Meridian bladder, you can see it here. I show you. This is meridian bladder on the back, and we do some cutting, flesh cutting. Only do some cutting, cut at the end of the session to treat stagnation. This point to treat problems, this is bladder 13 for the problem of the lung, like asthma. It's very efficient, this point, but also for blood, this bladder 17. On bilateral, on the back. At the end, we put some needles, tape with ball, named Pionex. Pionex, I show you. The Pionex is this. At the end of the session, until the other session, this is kind of tape with a very small needle of 0.6, put it on the ears, on the land, on the chainman to be relaxed, and there is some a little ball here to be massed by the patients until the other session. So it's very efficient. They use it at the end of the session, auriculotherapy. But at the end, they use also some phytotherapy. Phytotherapy, some medication in traditional Chinese medicine, that is conditioned like our medicaments, our drug. The same with all technological way to keep the medication, but it is phytotherapy with efficiency. So thank you for, I finish. Thank you for everything. I hope that it wasn't, thank you. Do you have any questions? Because we have a session of practice about only to see the needles, because I bring some needles to try to on it, not on your skin, but on apples. I have an apple. If you want to try it, you are welcome. And if you have any questions, you are welcome. This is because our president told me to speak about 5 elements, traditional Chinese medicine. But in our hospital we use auriculotherapy with electrostimulation. But in China they use also this kind of medicine, acupuncture scientists, acupuncture with electroacupuncture. This kind. When I went to China, they had the same. He was yellow because he's very old, and they use it frequently at the hospital to stimulate the needle and to keep some vibration on the acupuncture point to be more effective. That's the focus of these kind of tools.
Second point of view.
Do you have any questions? Okay.
How long did it take you to learn?
To learn this, I went 1 year to France. In each month, I went 4 days at the end of the month to get a diploma in France, in Paris, in Kremlin-Bicêtre with Nadia Wolf. But I did a lot of courses in Morocco, but also in China, in Academy China. But it's easy. You need to practice. The important thing not to be afraid of to put a needle, because a needle is very tight. Not a needle like this kind of needles are 4.16. Very thin, and we can do it. It's easy to practice. I will show you how to practice. Very easy, because we need to use this kind of medicine to help us. I do some how we do. We need to practice and to be allowed with the manipulation of the needle. Donc a needle like this, I put the tube, and it's okay. It's not painful, and we need to because the effect of acupuncture is to feel the Tai Chi. When we move, we feel until we feel some sensation of vibration or like on the skin. It's very important. That shows us that we are efficient in acupuncture. And when there is a color, red color around the needle, that's okay, we can stop. The course, the session, acupuncture session is about half an hour, 30 minutes. But even we see that there is a red spot around the needle, it's okay. We can take off the needle and take it, put it on the... But it's important too to use moxibustion. Moxibustion is the using of moxa. Moxa is named in French l'armoise. C'est de l'armoise. It's a moxa. It's a plant, birds, and make some warm and heat on the acupuncture point to be released, relaxed, and the flow of the blood is very easy, and we can use acupuncture after moxibustion with more efficiency. That's why they use moxibustion, but it's very efficient. If you want to try a practice session, if there is some volunteers, if there is, you want. Only the point you can lie on the stretcher, be comfortable. Yes. Yes. The first thing is to allow. You need to wash your hands before every session with like we use in our hospital. But the most important thing too to do on the skin. I used to do acupuncture before, but in 5 elements strategy they use it at the end. So for this point, disinfection with alcohol and we need to put it's we put it after user first single use. We put this needle through the tube and we take it, fix it with the index and with the third finger. We take it and we explain to patient it's okay, it will be good not to have vagal shock and to be like this, but not. The point is ego. Ego is large intestine as a part is very important for the immune system and for the immunity and when we have a headache. Donc, what I do? I put it's painful? No. It is painful? No. It's okay. Then we start to do only turning. We need to feel something because if we don't feel anything, it's not acupuncture. Acupuncture needs to show that there is a Tai Chi to keep stimulation all meridian to keep a balance and to stretch and to tonify the meridian obstruct or blockage. That's okay. Then every time we use alcohol, this is another point. This is large intestine. I feel because it should be a connection with patient. We need to help patient and to like to that he will be better because he has pain, pain. So we need to be that he will be better. This is large intestine is located on the elbow. On the extremities of like this. I can pour it here. There is some oxide
Il y a les Espagnols,
but I used to do kind of
Barcelone. Voilà, si vous voulez, on va faire
and I burn it with some. I don't want to burn it, but it's important to know that we need to burn the point.
What?
The hospital that you went to.
Briquette, yes, thank you. Thank you. I need a tool. A cup of water. A cup of water, please. Some water. Do you have some water? Yes. We need water.
Yeah.
Cup. So, the burn it. It's well sticky. It's sticky. And when it's burn, she feels better. So when she's hot, it's good. When it's not hot, it's very fine, very painful. So you have the time to take off the. Now I didn't put the needle, but I put it on directly on the stick. And we wait about 2 minutes, 3 or 3 minutes. Even the person feel warm and hot. It's good. After this, we can use on the same point on the skin acupuncture to have best result of the sessions. That's the way. It's, acupuncture and moxibustion used since 5,000 years in China. But not only in China. In China, in Japan, in all countries around Japan, because they traveled and the same treatment and medicine. But there is also another kind of. I show you. Good smell. Use it on your own, with your family. This kind of acupuncture. I do it in my operating room. I do it for all patients. I don't use midazolam. I use only the needles because we have no midazolam in Morocco. We don't. We stop to have the laboratory. Don't have. I do something. I use the yin pounder between the herb rolls. Yin pounder. It's not painful. Nope. Yin pound. Taiyong is the 2 extra points use it. I will show you. This is the point that I use. For OCT, in your operating room, you can use needles or other things. I use this Taiyong first. Then here too. Taiyong. But with the work, I have a lot of patients in each day. So I use a tool that I bought in China. I found this mask or make some massage on these points. And we hear some and water. Can use it.
아, 가상 체험하는 건가 봐요.
It gives massage, relaxation until getting to the operating room. This is the same point. And there is a point, 6 and songs on the top of the head that we can use. It's a relaxation. But we can see, you can see, because it's a glass. You can see like, it's not like hypnosis, but we need to mask this point on the elbow, on the eyes and the eyebrows and the forehead. You can use it. It's okay. It's not very okay. You feel the warmth, but here it's better. You can I will use it for you. You will see. Yes. Because it's what? You feel relaxed.
Isso se spalma.
When you have the low back pain. In the operating room I use the electrostimulus.
And do you think there is also
At the end, it's okay. And I keep this. Not there is no need to use it. But for needles, we need to try not to the needles on the container. Very important. Also, sure, even the person working at the hospital, so they keep some feel better.
so you're doing it as a pain specialist, right?
Yes.
But
Pain specialist, but also in the operating room.
Try already, yes.
Intensive care. Yes, I do it.
what does it indicate?
Indication, all indication. With pain, with anxiety, with we use this for everyone. It's difficult to use the back point on the system, but we can use this point.
In another side.
Edema, yes. It's work. Because we do disinfection, and it works because there is some release of some substance to keep the balance, to move the cells, red cells, white cells, cytokines. It's good. It stimulates the thermophile.
With the pancreatitis, you know, where there's a lot of cytokines and everything, pancreatitis is also
Yes, I do it for all patients all in the intensive care unit. I do it when there is some broken ribs, with pneumothorax, with bone fracture. I use for the pain because the patient is not okay, he's painful. So when we do this kind of medicine, it's efficient and keep the patient in relaxation, there is some result. We can extube the patient after 2 days. Even you can use it for everyone, for all patients admitted to the intensive care unit. There is no side effect, only disinfection and using needles. Needles is not expensive, like medications, that is very expensive. So we use medication, but also needles. Needles and some comprehensive way to know that patient need to be relaxed, not in stress, because stress is a barrier of the medication. We have affection, we have immunity is low when there is stress. And when we use this kind of to the bed.
Maybe also with, at the end, the most intensive care syndrome, PICS,
What?
PICS, most intensive care syndrome. So
Yes.
I think that
Yes,
maybe also
yes, it's very good, very good. But I think for all patients need to be, because there is some accident, some lose of family member. So we need to help those patients to be comfortable with the medication. We use our Western medicine, but we need to keep this kind of old medicine with us right now. That's my idea. There is some study, a lot of study prove that there is efficiency, but we need to do a lot more study. Every week at the intensive care at the operating room.